Mr. Secretary, it's great to see you again. The last time I saw you in person, we were in Eagan, Minnesota, so it's great to see you. I want to start just by saying thank you. I can't tell you how pleased I am about yesterday's announcement that HHS will enforce civil rights protections for LGBTQ Americans related to healthcare. So thank you so much for your leadership and the administration's inclusion as a matter of policy. Uh, Also, as I listen to your testimony here today, it's all of the reasons and thinking behind why I'm here. That is, we've got to have a robust funding program for the NIH, for CDC, restocking the national stockpile, addressing maternal mortality and morbidity. All of these things is exactly why it's such an honor to serve on the Health Subcommittee in this Congress, and I'm just so proud of your leadership in this administration. Beyond all of that and the funding for these agencies and making sure that we have world-class innovation coming out of them, my top priority in Congress is to lower the cost of healthcare and prescription drugs and improve access for all Americans. Last month, I was proud to reintroduce a bill called the State Healthcare Premium Reduction Act. That would provide HHS with funding to help states set up reinsurance programs or extend financial assistance to folks on the individual market. We all know that that remains a critical issue, lowering and stabilizing the cost of healthcare out there in the individual market. According to the CBO, this bill would actually lower premiums by about 8% in the individual market. Secretary Becerra, do you have any comments on that as a policy matter, and does HHS support, just as we did for a few years at the beginning of the Affordable Care Act, helping states with federal funding to set up those reinsurance programs and lower premiums in the individual market?
Congresswoman, great to see you, and absolutely agree with what you've said. We need to have a stable market. Reinsurance is one of the ways that we can help make sure we do.
Well, thank you so much for that. Reinsurance obviously is just one tool that we can use to shore up the ACA and to make sure that healthcare is more affordable for hardworking Minnesota families. Next, I want to turn to the American Rescue Plan for just a moment, which included health insurance premium assistance for so many Americans at a time when they're struggling financially. And I want to give credit to my colleague and classmate, Representative Lauren Underwood, for her championing and persistence in making sure that this was part of the American Rescue Plan. The landmark legislation extended ACA subsidies to more Americans, including for the first time, individuals with income above 400% of the federal poverty line. I also just want to take a moment to give this administration credit for reopening for that special enrollment period during a public health crisis, the ACA to Americans. So, Secretary Becerra, can you just briefly discuss the impact of the enhanced subsidies on premiums and how many individuals you've seen already with their monthly premiums decrease?
Congresswoman, the fact that there are 1 million new enrollees to the Affordable Care Act during the special enrollment period shows what happens when you give them a chance to learn that they can save money. And that was because of what you all did with the American Recovery Plan by giving us a chance to reduce the cost of their premiums. Now, the American Family Plan, which we hope that you will get to as well, will make permanent those savings that those Americans who are signing up for coverage are getting. And what's great is if you get 4 million more Americans coming on board because they too will save money, guess what you've done? You have just put a major, and to the chairman's thinking, more than just a dent in the uninsured in America. You are really going towards getting us to the point where every American can really say healthcare is a right, not just a privilege.
Secretary Becerra, you read my mind because that was my last question to you about making that permanent. So thank you so much. In the time that I have remaining, I just want to note that the importance of the 340B program, how important that is for providing access to care for low-income and rural patients in my district, I'd encourage you to take swift action to protect that vital program. And with that, Madam Chairwoman, I yield back.